Okay, welcome back everybody. And this is the final lecture for this week, and it is on chapter 1.3 and medication therapy management in the 21st century. So we all have witnessed the pharmaceutical companies, they have started to develop many drugs. And it seems that physicians often treat our ailments and diseases with medication. And because of this, we have seen an increase in drug interactions that can be very harmful and dangerous. So because of that, we not only have prescription drugs that you go to the pharmacy and pick up, but there are also what we call OTC medications, which are known as over-the-counter medications as well. And when a medication can interact with a prescription, um, which has made the pharmacy or physician's job much more difficult. So they have, as we progress in pharmacy, we're starting to see more medication therapy management that is assigned to a pharmacist, and this gives the pharmacist the opportunity to focus on that, and it has gained more responsibility for the pharmacy technician. Um, so when we look at prescriptions, prescription medications, you may also hear is referred to as legend drugs. It's kind of an old term, but you will hear that word used, and I wanted to put that on this PowerPoint. So if you ever hear legend drugs or prescription drug, that means you have to have a prescription to get the medication. And then over-the-counter medications or OTCs are ones that you can go to the pharmacy and pick off the shelf and go to the cashier and buy, like Sudafed. Um, One of the more common drug-to-drug interactions that we see is we live in America, and there's many Americans that are on high blood pressure medication. And one of the common over-the-counter medications that can interfere with high blood pressure or can interact with high blood pressure medication is cold medications like Sudafed. So it's kind of the pharmacist's job to, if a person tries to purchase cold medication and they have a history of taking high blood pressure medication, they need to be aware that there can be an interaction, because a lot of us out here in the world don't know that. So because these drugs are becoming more and more, it's harder to manage all this. So that's why we've started with MTMs, is what they're called. That's the acronym for medication therapy management. And their expectation is to manage some of these interactions. Drugs can interact with diseases, like pregnancy is considered a disease, which I know a lot of you may not think that, but if you are pregnant and you're on medication, that could be counterintuitive. So you don't want to take certain medications while you're pregnant. Or certain foods. I know a lot of MAOIs, which are some old antidepressants out there, really interfere with cheese or lots of foods, actually, to be honest. And then other medications, we call that a drug to drug interaction. So you have like drug to disease, drug to food, drug to drug. And those are some of the interactions that we talk about in pharmacy. Um, so the pharmacist's job in medication therapy management is to act as a counselor and a case manager to help patients choose, use, and monitor their their drugs in a holistic manner. Um, so it also has allowed pharmacists to manage drug formularies that have been controlled by insurance companies. I mentioned this in the first video, where insurance companies mandate what medications go on a formulary, which is a list of drugs that they will pay for. And it's kind of the pharmacist and the technician's job, both, to make sure that the patient is getting coverage for their medications, because they're expensive. And so knowing what is on formulary and understanding that is really important. Staying on top of what new drugs are being released. There's drugs being released all the time, and it's the pharmacy's job to make sure that they're watching what's new, what interacts, and staying current with the new literature and science that's coming out. And then also, we used to just use brand drugs, but I think it was in the 70s they started using generic drugs. I think there was a law released that you can start using generic drugs because drugs were getting so expensive. So what has happened, let me give you a little background on this, and I may cover this a little bit later in chapter 2, but drugs are really, really expensive because let's take, for example, the drug Advil. And the generic name for Advil, if you do not know, is ibuprofen. So if you go to the pharmacy and you buy Advil, or you go to the pharmacy and buy ibuprofen Walmart brand, which one's going to be more expensive? The Advil will, because it's made by the company. So the law is that a manufacturer that creates a new drug, they have a patent, which is an invention patent, on that drug for 3 years. So they own that drug for 3 years and no one else can make it. So let's say Advil started making their drug tomorrow, and for the next 3 years, until August of 23, 24, 25, no one else can make anything similar to Advil. The only way you can get Advil is by buying the brand name Advil. And then after that 3 years, they have to release that patent, and then other companies can start making it under the generic name of ibuprofen. And they can't change the active ingredient, but they have to change the inactive ingredient. So if you ever go buy Advil and you look at a capsule of Advil and compare it to like a generic form of Advil, the ibuprofen, those capsules look completely different. Like Advil will have an enteric coating on it. It'll have the little name Advil stamped on it. It's nice and smooth. It's actually easier to swallow. It passes through the stomach acid and it doesn't break down in the stomach, where the generic form of Walmart or Walgreens doesn't have that enteric coating on it. It's not smooth. It's kind of chalky. It's a completely different inactive ingredient for you to take. So um, that is something to think about. And when every time these things come out and happen, pharmacists need to stay on top of it and know what's going on, because the brand name's way more expensive than the generic. And part of our job as pharmacy technicians and pharmacists is to make sure that we are giving our patients the best price and that we are managing the opportunity for the patient so that they have the best outcome. And that is the whole point of MTM, medication therapy management. There are a few other things that have come into play because of this, and one of them is collaborative practice agreement. And this is a formal agreement where physicians will make a diagnosis and supervise patient care and refer patients to a pharmacist for protocol-based care. So they may say, like, this is your diagnosis. I'm going to monitor you, but I want you to go to this pharmacist and we're going to determine what medication works best to treat it. They do this quite often in a hospital setting because a lot of times patients will have multiple medications, and a pharmacist and physician, they'll have like what we call an interprofessional team, and they'll all sit around the table and they'll look at the patient's chart, and they used to call them brown bag lunches, and they'd look at the case and the pharmacist would say this is what they should be on because it can interact with this, and they have allergies to this and this has this dye in it and whatnot. And physicians aren't going to know all that. I mean, they have enough to know than all the stuff a pharmacist know. A pharmacist is a doctor of medication. They're a doctor on drugs. So why not let the pharmacist make the decision on what drugs would be best for the patient? So this is the collaborative practice that we're starting to see become more and more popular. It allows the patient care can include assessments from the pharmacist, selecting, initiating, administering, monitoring, adjusting medication regimens, and then research supports improve. It shows that when we have pharmacists do this, we have seen a big improvement in patient care through this process. So it's going to become more and more, you're going to hear it more and more, which is going to result in pharmacy technicians having more responsibility, which brings us to this practice. So Pharmacy Practice Module Initiative, the PPMI, this was developed by ASHP and it's to improve patient care outcomes. And basically it is education and certification for pharmacy technicians that encourage the implementation of pharmacy practice that will improve the quality of healthcare. So when you go and look at pharmacy certifications, You can, when you're done with this class, you can go get your general basic pharmacy certification, but there's no advanced practice involved. And there are lots of other levels of certification you can obtain after you obtain this one that you're going to get today. The one, or not today, but after the end of these courses. So at the end of the year, you can sit for your pharmacy tech, certified pharmacy technician exam, and you're going to get a basic bare minimum. And you can go work at Walgreens and you're going to get basic salary, low, you're a level one pharmacist, pharmacy tech. But if you want to advance in the field, you can add these advanced technician practice certifications onto it. So if you're a level two pharmacist or you have this advanced practice, they're starting to incorporate a thing right here. It's called tech to tech checks. And what that means is when you fill a prescription in the pharmacy, when you fill it, the pharmacist has to check it every single time. The pharmacist has to check it. And they want the pharmacist to focus on medication therapy management. So if they're doing that, they don't have time to check everything you guys fill. So if you have an advanced practice certification as a pharm tech, you're going to be one of the lead pharmacists, and you can check the lower level pharmacist work because it's showing that you have more knowledge and education about medication. So that is, and you get paid more, and it's a career. I mean, it's a great career. Pharmacy technician is an outstanding career. So there's also other opportunities in like informatics and business administration specialists. Like that's what Walgreens, Mr. Walgreen did. He was an apprentice. So by getting these advanced practices through certifications, you can do that. Also, there is training in IV infusion, sterile and non-sterile compounding, therapeutic chemotherapy preparation. All those are a certification that you can add on top of the initial basic certification that you are going to get. And this has all changed in the last 7 years. When I got my certification, they didn't have any of this. So this is all new. Pharmacy technicians are going to start giving vaccines now because there's an advanced practice. If you have your advanced practice, you can give vaccines. There's just a lot of opportunity for growth as a pharmacy technician. So something to really think about and investigate. That is all I have for you guys tonight, and I hope you have a great rest of your week, and we will see you next week.